Consuming red meat is linked to an increased risk of heart diseases, including stroke and myocardial infarction, as well as breast and prostate cancer. Hello, and welcome to Medical University on YouTube. This time, it's about the lifestyle and dietary habits that pose a risk for colon cancer, saying that you should at least stop these for early detection of colon cancer. And for the sake of early detection of colon cancer, when you first get colon cancer, the initial symptoms as well, I will talk about this. In the latter half, it is actually difficult to detect colon cancer early from symptoms, so I would like to talk about which examinations to recommend as a doctor who diagnoses colon cancer in general outpatient. Actually, colon cancer was the most common cancer among Japanese people in the data of 2015. Especially for women, colon cancer is the first cause of death among types of cancer, and this colon cancer is increasing in incidence year by year. It is increasing due to the Westernization of food. Fast food and family restaurants are becoming more convenient and tastier. Colon cancer cases are rising as meals become more convenient and tasty. However, if detected at stage 0 or 1, the 5-year survival rate exceeds 90%. Unlike pancreatic cancer, colon cancer is often discovered in later stages. Even in cases where it has progressed, there are many cases where surgery can be performed or it can be cured with chemotherapy. So please listen to the end about what symptoms will appear if you have colon cancer. Rather than the initial symptoms of cancer, it's normal to think that you don't want to get cancer. Various studies are being conducted on this colon cancer, so we understand the risks that make it easy to get colon cancer. Even when it comes to cancer, it's important to think about pre-symptomatic state and reduce the risk of disease before getting sick, which is very important. Therefore, knowledge about preventive medicine remains very important, but hospitals are making money by curing diseases, not by preventing them. Generally, it is not permeating. At YouTube Medical University, such a thing. We are responsible for explaining methods to prevent diseases at an early stage based on data in an easy to understand manner at YouTube Medical University. Therefore, I think it would be great if you could subscribe to the channel and catch the latest information. And then, at the end of this video, I will introduce 2 lifestyle and dietary habits that can reduce the risk of cancer. It's well known that smoking increases the risk of various cancers. However, whether the risk of cancer decreases when a smoker quits smoking is another story. There are many behaviors that increase the risk of cancer, but there is little data to suggest that certain behaviors can reduce the risk of cancer. With that said, there are few ways to reduce the risk of cancer. I'll introduce 2 lifestyle habits at the end of the video, so please listen. Today's agenda. First, I'll explain the colon's role in more detail. Then I'll discuss the early symptoms of colon cancer that concern everyone. I would like to introduce 4 selections. Then, for the third point, I will introduce 5 risks that should be controlled to prevent colon cancer. Then, for the fourth point, I will introduce 1 important examination to detect colon cancer early, because it is asymptomatic. Finally, for the 5th point, I will discuss the few data available. I would like to introduce lifestyle habits that can reduce the risk of colon cancer. It will be a long video, but this video, in one, I hope to make all the important points about colon cancer easy to understand. I would be happy if you could listen to it many times or listen while taking notes. So first of all, let's review the role of the colon first. The colon is the digestive tract closest to the anus in the passage of food. The nutrients taken in from the mouth connect to the stomach and small intestine and finally enter the colon. This thick tube is the colon, and its total length is said to be from 4 feet 11 inches to even 6 feet 6 inches. It's surprisingly long, isn't it? As for what it does, one is the absorption of nutrients, and another important one is the absorption of water. Most of the nutrients are absorbed in the small intestine, but water is not so much absorbed. The food that goes from the small intestine to the colon gradually loses water and becomes feces. Therefore, at this stage, the feces are soft, but by the time they reach the end, the feces have hardened. This colon can absorb up to 6 liters of water a day. It is said to have an amazing power. In hospitals, specialized names are used, so if I explain the specialized terms, it is divided into the colon and rectum. The rectum is near the anus, and the colon is divided into 3 parts. The ascending colon going up, the transverse colon going sideways, and the descending colon going down. And between the rectum and the colon, there is an S-shaped colon that is bent in an S shape. All of these are collectively called the colon, so wherever it occurs, it is generally called colon cancer. At the stage where it passes through this ascending colon, the feces are soft, which is important for understanding the initial symptoms. So secondly, I would like to introduce the 4 initial symptoms from which cancer can develop when colon cancer is detected early. There are videos with titles like Initial Symptoms of Colon Cancer on various YouTube videos, but for colon cancer, there are no initial symptoms as clearly stated in the guidelines, so I will discuss the primary symptoms in this presentation. I will explain what kind of symptoms occur when colon cancer has grown to a certain extent. It may be repetitive, but even at the stage of primary symptoms, colon cancer can be cured by surgery or chemotherapy. So please listen with hope. The first line of the primary symptoms of colon cancer is that the stool becomes thin here. This image shows a colonoscopy of colon cancer. Colon cancer causes the inside of the colon to gradually fill up and narrow the lumen. The passage for the stool becomes thin, so the stool becomes thin. However, as we mentioned earlier, the stool becomes hard in the latter half of the colon, therefore here. When cancer forms, the stool itself is soft and can pass through. It can pass through here without becoming thin, so there is no thinning of the stool. The stool becomes thin when a tumor has formed in the latter half of the colon. If you understand the function of the colon like this, you can predict the symptoms. What you should be careful about is not to worry that it's colon cancer just because the stool is thin only once. Everyone has different sizes of stool, so if the stool is clearly thinner than before, and it continues to get thinner and thinner, there is a possibility of colon cancer, so please be careful. Consider seeing a doctor. The second primary symptom of colon cancer is constipation. I think you can understand it well if you watch the videos so far, but cancer narrows the inside of the colon. Therefore, bowel movements become poor, and you may become constipated. Other factors include the growth of colon cancer in the colon, which makes the colon difficult to move and makes it difficult to excrete stool. There may be such factors, and it is inflammation caused by colon cancer, and the inflammation causes our stomach to move slowly. Even due to colon cancer, you may become constipated, which is a common symptom, of course. But if constipation does not improve and constipation worsens, it may be good to consider colon cancer. The third symptom of the onset of colon cancer is anemia. For those wondering why anemia can occur in colon cancer, there is something called neovascularization. The colon, which serves as a passage for feces, begins to grow with the development of colon cancer. Cancer has new blood vessels called angiogenesis, which are new blood vessels that begin to grow abundantly within the cancer. Our DNA-constructed blood vessels are intricately made to prevent easy bleeding. However, cancer can lead to bleeding. The temporary blood vessels are delicate and can bleed when feces pass or the colon shifts. They are prone to bleeding due to stimulation. As a result, there is gradual bleeding from colorectal cancer, leading to anemia. And the problem with this anemia is that it gradually worsens as the bleeding continues. Rather than blood coming out in a way that turns the toilet bowl bright red, like hemorrhoids, for example, there is often gradual bleeding that is almost indistinguishable from the color of the stool. Even when I was seeing patients, I diagnosed a man in his 70s who came to the outpatient clinic saying he had been feeling breathless recently. His face was very pale, so I thought he might be anemic and took a blood test, which showed a condition called hemoglobin. Normally, the value is over 10, but this man had only 4. I thought this was strange, and upon further investigation, I found out he had colon cancer. So, the symptoms of gradual blood loss, such as fatigue and a pale face, are important. If you have such symptoms, please consider visiting a hospital. The fourth symptom of colon cancer is bloody stool. As I mentioned earlier, bleeding can occur from colon cancer. It's often difficult to detect this bleeding, but if the bleeding is from a part of the colon close to the rectum, red blood can mix with the stool. One of the diseases when you see red blood in your stool is colon cancer. In addition to that, there are hemorrhoids, and there is something called a colon ulcer, where a small hole opens in the colon and bleeds from there. And let me tell you about the symptom where the stool turns black. I think many health-conscious people are aware of this. In fact, in colon cancer, the stool turning black can be a sign of bleeding. There were some information videos in YouTube that were not explained well or were slightly mistaken, but actually, even if you bleed from the colon, the blood can oxidize and turn black and come out as stool. The blood that comes out immediately is red, but if it stays in the body for a long time, it oxidizes and turns black. Please remember that. And this blackness is characterized by being as black as this stethoscope. To explain in more detail, when blood comes into contact with the digestive fluid of the stomach acid, the red blood turns black. Therefore, the stool is black. In such cases, there is a possibility of colon cancer, but more often it is gastric ulcer or gastritis or bleeding from the esophagus, which also results in black stool. So even if you don't have cancer, if your stool can be black, it's a very dangerous situation. So if you notice it, I recommend you to go to the hospital without waiting even a day. So what are the risks for colon cancer? I will explain 5 of them. I will talk about 5 risks of colon cancer. The first one is red meat and processed meat. Red meat refers to meat in red color in general, which includes beef and pork. Chicken, which is white meat, is not included. The point is that meat is important. It provides protein, essential amino acids, and key nutrients like vitamin B12. These meats contain a lot of nutrients, but there is data that processed meats made from these meats increase the risk of colorectal cancer. And it's not just colorectal cancer. Speaking of this red meat, it's said to increase the risk of cardiovascular diseases such as stroke, breast cancer, myocardial infarction, and prostate cancer. And processed meats add to these risks, with data suggesting they make you more susceptible to colorectal cancer and diabetes. That's not to say you should definitely avoid eating them. I eat meat regularly myself. The important thing is not to blindly accept this data, but to understand how many grams are dangerous and why they are dangerous. For red meat, it is said that if you consume more than 3.52 ounces per day, the risk of colorectal cancer may increase. And for processed meats, there is data that says consuming 1.76 ounces per day increases the risk of colorectal cancer. As for the quality of the data, it's safe to assume that these risks do indeed increase with processed meats more. Speaking of hamburgers from restaurants, 5.29 ounces is the amount you can eat in one meal, so 1.76 ounces of processed meat is actually not a small amount. In contrast, if it's under these amounts, there is no data that the risk notably rises, so just because various videos say that red meat is bad and you shouldn't eat it doesn't mean you should stop eating it. There's a lot of information out there, so it's possible to catch the wrong information. Let's remember why it might be dangerous. The reason processed meat is dangerous is because of the additives, and salt is also mentioned. In particular, it is said that there is a possibility that a preservative called nitrite salt, which is particularly noteworthy, may actually have a negative impact on the human body. These preservatives are said to increase the risk of cancer by causing inflammation in the body. Processed meats are high in salt, so taking in too much salt itself can lead to high blood pressure and increase the risk of stroke and myocardial infarction. But it's not like all processed meats are bad. If you choose meat that has fewer preservatives and less salt, there is a possibility that it could be safe even if it's processed meat, so don't just blindly accept anything. Understand why it's bad, and ultimately, I hope you can make your own judgment about whether this is good for your health or whether what this person is saying is correct. At YouTube Medical University, we are broadcasting such information, so I would be happy if you could learn all at once. And why is red meat, which is not processed meat, are said to be a risk? It's said that red meat can easily cause constipation and increase the type of bacteria in the intestines called harmful bacteria. In short, it can cause constipation and disruption of the intestinal bacteria environment, which leads to increase the risk of colon cancer. Lack of exercise is the second factor that can lead to constipation. As mentioned earlier, constipation may be a risk factor for colon cancer. If you lack exercise, your bowel movements may slow down, leading to constipation. It is said that this could potentially increase the risk of colon cancer. The third risk factor for colon cancer is obesity. People with a body mass index of 25 or more are said to have a higher risk of colon cancer. Body mass index is calculated by dividing weight by height twice. So if a person is 160 centimeters tall and weighs 50 kilograms, the value is calculated by converting 50 to 160 centimeters. That is 50 divided 1.6 divided 1.6. If the value is over 25, you are at risk for colon cancer. The fourth risk of colon cancer is excessive drinking. If you don't know how much is implied in the word excessive for beer, this means about 1 large bottle, and for sake, it's about 1 cup. If it's wine, it's about 2 glasses per day for both men and women. There is data that shows that the risk of colon cancer increases if you drink more than this. According to some data, the risk of colon cancer increases by 1.4 times. In addition, alcohol has various effects on a digestive organ. The risk of cancer in the passageway for food increases. Oral cancer is cancer inside the mouth, while laryngeal cancer affects the throat. esophageal cancer, which is cancer of the esophagus, and also risks of liver cancer and colorectal cancer. Please be extra careful with those who turn red when they drink alcohol. I won't go into detail, but these are people who have a hard time metabolizing alcohol. Acetaldehyde, a substance that builds up in the body, is believed to raise the risk of esophageal cancer. Those who flush red from alcohol should be cautious. The fifth risk factor for colorectal cancer is tobacco, which, like alcohol, raises the risk for all cancers. The reason is simple because it contains carcinogenic substances. Tobacco is a risk for various cancers such as lung cancer, stomach cancer, colorectal cancer, etc. It can also reduce lung function. On the other hand, there is data that lung function gradually improves by quitting smoking at any age. So it's never too late to reduce or quit smoking. Please consider it. Of course, if you love tobacco and it's a joy of life and you don't want to live long without that joy, I think you don't necessarily have to quit. That's something to decide after discussing your life with your primary care physician. Please wait for that. Thank you. There are no initial symptoms in colorectal cancer, and that's why I want to introduce the recommended exam for early detection to improve the 5-year survival rate. The important test to detect colorectal cancer early is the Fecal Occult blood test. Fecal Occult blood test. This means using this kit to collect feces and submit it. It's a test. Generally, it is done for 2 consecutive days, and if even a little bit of occult blood is mixed in, it becomes positive. But this test, as I said, even hemorrhoids can turn positive, and polyps can also turn positive, so it's not necessarily bad for colorectal cancer. I often hear such things, but this Fecal Occult blood test is a very important test. One of the tests that can be done for free in Japan as a part of this is the Fecal Occult blood test. There is no diagnosis of colorectal cancer. There are few tests where the merits of conducting the test on everyone outweigh the demerits. These include stomach cancer screening, colorectal cancer screening, breast cancer screening, and uterine cancer screening. There are no tests for pancreatic cancer, prostate cancer, or brain tumors that are covered by public funds or supplemented by cities, towns, and villages. The reason for this is that even if these tests are conducted, the likelihood of finding cancer is low, or the benefits of conducting the test are not clear. The side effects of these tests can be significant. In other words, there is data that shows that the benefits of this Fecal Occult blood test are greater for everyone, and anyone over the age of 40 should take it. By taking this Fecal Occult blood test, the risk of death from colorectal cancer can be reduced by 20%. This test is covered by public funds, but only 40% of Japanese people take it. Why is that? 5 to 10% of people who test positive for this Fecal Occult blood test are found to have colorectal cancer. So what about the rest? About 50% of people are found to have colorectal polyps, or the blood may be mixed with hemorrhoids, causing the Fecal Occult blood test to be positive. It's not always because there is colorectal cancer. A positive Fecal Occult blood test doesn't always indicate cancer. In advanced cancer, 80% test positive, while only 50% test positive in early stage cancer. Even with a positive result, about 5% don't have cancer, and cancer isn't always detected. Testing positive for cancer doesn't guarantee having the disease. Many think this makes the test meaningless, especially when you think only about 5%. However, there is a data I want to introduce. In cases where the Fecal Occult blood test is positive and a colonoscopy is performed afterwards, half of the people who were found to have colon cancer were at stage 1. Compared to that, people who had symptoms like bloody stools or thin stools and were found to have colon cancer after a colonoscopy, only 17% were at stage 1. In other words, by the time symptoms appear, colon cancer is often advanced. In short, the Fecal Occult blood test is the only means to detect colon cancer early. It's a critical test. In fact, I got a patient who had previously tested positive, and she said she thought it would be fine because she had hemorrhoids, so she didn't have a colonoscopy. But the fact is that the probability that someone who thinks they have hemorrhoids will get a positive result on a Fecal Occult blood test is less than 5%. In other words, even in case you have hemorrhoids, only 5% of people will get a positive Fecal Occult blood test because of that. So even if you think you have hemorrhoids and your Fecal Occult blood test is positive, you can't just decide it is because of hemorrhoids. You might think that it's okay to take it once already, but even if you take it once and it's negative, the positive result you got the first time is not necessarily due to hemorrhoids. So if you were positive even once, we recommend that you always get a colonoscopy with additional scrutiny. And one more thing about polyps. Fecal occult blood is actually an important test to detect polyps. And how does it relate to colorectal cancer? Actually, 80% of colorectal cancer is something that grows from polyps. To be more specific, it's something called an adenoma among polyps. Half of the things that become positive in fecal occult blood are polyps, but there are these adenomas among polyps. Actually, this adenoma grows and becomes colorectal cancer. This is called cancerization, but there is something that becomes cancer. In that sense, if you take the fecal occult blood test and it is positive, it's recommended you have a colonoscopy and remove the polyps at this point. By doing so, you can prevent cancer. In this sense, the fecal occult blood test is a very important examination. I explained in detail and for a long time, but I can't explain this far in the short time of outpatient service, so the fecal occult blood test is not well known to the public. If you found this story important, please share this video or its contents with others to help reduce colorectal cancer suffering in Japan. I'll be happy if you can lower your risk of colorectal cancer. I'll discuss 2 lifestyle habits. You may wonder why I'm not sharing 5. In fact, there are many risks, but there are a few things that I can say if you do this, the risk will definitely decrease. So this time, I will introduce 2 carefully selected ones with data. At first, dietary fiber is a lifestyle habit that reduces the risk of colon cancer. I think it's said that vegetables are good for the body, but the dietary fiber in vegetables is particularly good, and what is said to reduce the risk of colon cancer is insoluble dietary fiber. Insoluble means it doesn't dissolve in your stomach. To put it a bit crudely, you might notice that things like mushrooms, which contain dietary fiber, come out in your stool just as they went in. That's insoluble dietary fiber. I think you image rough texture in this kind of dietary fiber. Like shiitake mushrooms, bamboo shoots, soybeans, barley, and lettuce are examples of such things. Let's not just finish only by saying eating them are good for health reasons, and know the reason why. These types of dietary fiber help alleviate constipation by promoting regular bowel movements. Mushrooms can pass through your stomach as they are, so even if you've been eating red meat, which can cause constipation as I mentioned earlier, you can alleviate it by eating vegetables. It's been suggested that alleviating constipation may reduce colon cancer risk. One theory of why colon cancer can develop is that constipation allows cancer-causing substances to remain in contact with the colon wall longer, potentially causing colon cancer. Thus, relieving constipation may help. The fact that insoluble dietary fiber can reduce the risk of colon cancer is a compelling reason. The second method to improve the risk of colon cancer is exercise. I think some of you may have thought of exercise. It's often difficult to incorporate into daily life, but even moderate exercise is said to be good. What does moderate exercise mean? It's an activity that slightly increases your breath but still allows you to converse. Jogging or brisk walking, where you can still talk to friends or sing a song but can't maintain a long conversation, is considered good. So why is that? Exercise is beneficial because it reduces body weight and alleviates constipation. Lack of exercise can lead to constipation and increase the risk of colon cancer. Exercise promotes intestinal movement, alleviating constipation and lowering colon cancer risk. It also reduces body weight, which helps those who are obese and have insulin resistance. Insulin is the only hormone in our human body that lowers blood sugar levels. If its secretion is low or it doesn't work well, it can lead to diabetes. Actually, this state of obesity is a condition where insulin does not work well. There is data suggesting that this insulin resistance may increase the risk of cancer. Therefore, by exercising, obesity is resolved, and the difficulty of insulin working is also resolved, and the amount of insulin secretion decreases. It is said that this may reduce the risk of cancer. Of course, this is just one theory, and what needs to be noted is that there are people with diabetes who are injecting insulin. There is no data suggesting that the risk of cancer increases with those injections, so please rest assured. What do you think? This time I talked about some lifestyle habits that raise the risk of colon cancer, and also primary symptoms to be aware of. There are no early symptoms of colon cancer. However, it is important to be aware of the initial symptoms, such as thin stools or constipation, and blood in the stool as well. You may also got anemia. And then I talked about what could cause risks of getting colon cancer, like red meat and processed meat and lack of exercise. We mentioned smoking, alcohol, and obesity. It's hard to reduce all risks, but I recommend trying from what you can do. And for early detection of colon cancer, fecal occult blood testing is important. You can get a cancer screening at the public expense in your city, town, or village. So if you're over 40, please consider getting tested. And finally, to reduce the risk of colon cancer, I talked about insoluble fiber and moderate intensity exercise. For your healthy, long life, please try. Thank you for watching this lengthy video to the end. We'll continue providing easy to understand health information starting tomorrow. We will continue to broadcast with data and responsibility, so if you thought this video was good, please hit the like button and subscribe to the channel so you don't miss the next video. Your support will be greatly appreciated, so see you again. See you in the next video.